Hello, everyone, and thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE team, and the University of Iowa Employee Assistance Program. I am your facilitator, Dr. Laura Fuller from the Department of Psychiatry. Before getting started, I have important information to share about this program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, call 911 or go to the nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties, express or implied, with respect to the information provided herein or to its use. Okay, we are excited that you've joined us today. If you're watching the live stream version of this program, there will be time for a limited number of questions at the end of the presentation. Please use the chat function to submit questions. A recording of this webinar and further resources will be available on the Loop on the hospital website. Our presenter today is Maggie Moore, licensed independent social worker and director of the U of I Employee Assistance Program. For those who are not aware of this important service, the EAP is available to University of Iowa employees and their immediate family members. The EAP provides counseling and many other wellness-related services. Maggie Moore is also an adjunct instructor in the Department of Psychiatry and is highly regarded for her therapy expertise and lovely singing voice. The topic for today is self-care and resilience. During her presentation, Maggie Moore will help us think about how to care for ourselves and remain resilient in the face of the challenges that we are all facing. Here to tell you more without further ado is Maggie Moore.
All right. Hello. Thank you, Laura. That's just a lovely introduction and all too kind. I am excited about being here today. And what I hope that we'll talk about is resilience and self-care during the COVID-19. The EAP program, as Laura mentioned, is one of many programs at the University of Iowa under an umbrella of services designed to keep our faculty and staff engaged and well. And so we'd like to really think of resilience today as a mechanism to thrive and not just survive. One of the reasons that we care about the people here on campus, whether you're in the hospital, College of Medicine, whatever area you're in, is that we know that our well-being, according to the World Health Organization, is a state where we realize our own abilities, we can cope with the normal stresses of life, and we can work productively and make a contribution to his, her, their community. And part of what we focus on is how to achieve that is through a whole person approach. We know that physical health is hugely important, but we also know that our sense of purpose, which for many has been shaken a bit by the COVID-19, our social connections, which have been altered and changed, our financial well-being, and our sense of community all make up our sense of well-being. And right now, our brain is a bit on uncertainty because many of those things that we feel are important to us have been shaken or changed. So if you're listening to this on your own or with a work group, it's very likely that you are adjusting to change. You might be new to working remotely, asked to do different assignments. Your workload likely has increased, and you may be struggling with what you're supposed to be doing. Many of you are still going into work and working harder than ever, but the work may look different. Maybe a new location, new protocols, new assignments. No doubt, however the new normal is shaping up to be for you, resilience is warranted. We are truly living in unprecedented times. It can feel like we don't have a lot of control. Anxiety and stress is actually an adaptive response, and in our very primal beings has been there to keep us safe. Emotions are also contagious. So, in work groups or families or communities, we may find that we're all feeling stressed at the same time and therefore struggling. And when stress is beyond a normal limit, it can affect both our mind and our body. So why resilience? So several years ago, our health and productivity units, which is Live Well, Family Services, and then the UIEAP, began to discuss a way that we could have an impact on campus potentially through an initiative that would help people again be that whole person, have a whole person sense of well-being. And so we thought, do we talk about stress or burnout or depression or anxiety? And we stumbled upon the concept, which is very well researched in our ecological systems and other systems, about the concept of resilience. And what the research shows is that resilience is something that can be learned. And it's a fulcrum of sorts. So it keeps us beveling from one end to the other. It's a dynamic, reciprocal process, responsive to circumstances and contextual conditions. It is the capacity to work through and recover quickly from difficulties and not the absence of pathological responses. Resilience is the result of individuals interacting with their environments and the process that either promotes well-being or protects them against the influence of risk factors. These protective factors create a synergy for us. So our genetics, the things that we're stressed about, our perception and view, all of these things can work hand in hand to get through challenging times given protective factors that we've developed. Because what we also know from the research is there's a broaden and build effect that occurs. So we need resilience to get through trying times, but we get resilience when we've gone through those trying times. So we're going to talk a little bit about ways to build resilience and how resilience is defined. Resilience is the ability of an individual or organization to adjust to adversity, maintain equilibrium or balance, retain some sense of control over the environment, and continue to move forward in a positive manner. This is a system that has been discussed, a roadmap, so to speak, through the American Psychological Association, which has a great website, by the way, called Road to Resilience. They have offered up 10 evidence-based, research-supported ways all of us can enhance our resilience. These 10 ways to build resilience are things anyone can work on, no matter where you work, what kind of work you're doing, or how you're doing emotionally. There's something for everyone. And so I would really encourage you as we proceed in this meeting today to think about maybe one or two that seem to strike a chord with you as being particularly important for your needs right now. What we know about the COVID virus and the pandemic is that it affects everyone differently. And so your well-being plan or your building of resilience is also very individualized. Right now, though, many people are feeling overwhelmed, and that's pretty natural. We're worried about our children, older adults, and how to manage and navigate new routines. So let's get started. So number one, making connections. This might seem challenging when doing remote work or practicing social distancing with our friends, family, or colleagues. However, there really are lots of creative ways to feel connected with others in meaningful ways, whether it's outdoors or utilizing technology. Thinking of that as a way to stay connected to your work team and as well as your other colleagues and friends that you may not have direct contact with. Number 2, avoid seeing crises as insurmountable problems. Things might be tough right now, but your outlook and attitude or belief and perception of the situation plays a huge part in how you respond to these challenges. We have a sense of self-efficacy when we approach a crisis as something that we're going to at least try to get through. Taking a long lens approach can also be helpful. And that means focusing on what's really going to matter to you 6 months from now and make decisions based on that. Number 3, accept that change is a part of living. Once we can admit and accept that change is a constant, our attitude is automatically more resilient. Some days working on accepting change may be all you can do to work on resilience, and that's okay. Probably 38 years ago, I had a wonderful social work professor who said something to my class, and I think it was on understanding geriatrics, and it sticks with me today. He said, really, successful aging is all about how well you manage change. And I would say what I would add to that is how well you manage change is a protective factor and it increases your resilience. Number 4, move towards your goals. Whether goals are personal, professional, or both, staying focused on progress towards achieving your goals can help you adjust to change in a positive way. You can begin to notice a sense of mastery when things are accomplished, especially when our world seems fairly challenging right now. Sometimes if you talk to a friend and share your goals with someone else, maybe it is a friend, a counselor, a family member, and you write them down, your chances of achieving them increase. Number 5, take decisive action. Using the best information and instinct that you have, making decisions on how to move forward is essential. When we are extremely anxious, we can feel stuck and unable to take action on something. If you have that friend or counselor or family member to talk over decisions that you need to make, it can help you develop that skill. Number 6, look for opportunities for self-discovery. As humans, learning and growing is a part of life. Resilient individuals seek ways to develop different parts of their life. With challenges we're facing right now, all of us are discovering a lot about ourselves because we're forced to. For me, I'm discovering a lot about technology. And in fact, with our host today and earlier colleagues, I was saying that, we would not have had all of the access to technology that if the COVID had happened 20 years ago. So I'm finding that I'm actually have more of a mastery of technology, I hope I didn't jinx it, than I once thought. But also reading, journaling, and learning more is another way for self-discovery. Number 7, nurture a positive view of yourself. Probably you've heard of the term inner critic. This is the opposite. Nurturing a positive view of yourself is like having an inner cheerleader. We need to provide kind, compassionate, gentle, and encouraging thoughts for yourself, for working every day to do your best and be your best self. That means understanding and learning from our failures and mistakes and still giving ourselves credit for trying. When we tell ourselves negative things about ourselves, it's not helpful and does not foster resilience. So remind yourself that you're doing a great job. Number 8, keeping things in perspective. The things that you can control are the things that you should focus on. You most likely can control your actions, thoughts, and priorities. You can't control what's in your social media news feeds, but you can limit those as a way of keeping perspective. Practice mindfulness and practice gratitude as tools to help you keep things in perspective. Number 9, Maintain a hopeful outlook. When we talk about a positive future, we're modeling resilient. And I really want to point out that it's not denying that difficult things are happening. Again, it's that outlook that is reminding self that you can get through it. This can be really difficult and challenging times, but your mindset, having a resilient mindset, does matter. If you say things like, a lot of good can come out of this in terms of learning new things, or there might be an opportunity to develop new skills, that's the kind of outlook we need to nurture. And then last, but definitely not least, probably most important, because these skills can help us do the other 9 skills, taking care of yourself. So what do you need to do right now for optimal health and well-being in the future? One of our health coaches with the Live Well program has a little video on about sprinkles. And so we need to have the mindset that we can sprinkle resilience and sprinkle physical health and well-being throughout our day, and being in tune to what our body is asking us to do. Do we need to get outdoor time? Do we need to talk to someone? Are we getting clean, whole foods to fuel our body? Are we practicing meditation? Whatever it is, to be resilient and move through challenges in a positive way, taking good care of your whole self is essential. So, how do we cultivate resilience? Some days you may be able to do more than others, and you might focus on different things during different phases of your life. I want to now have you think about a concept and take this concept with you as you're thinking through those 10 ways of building resilience, your individual stress level, as well as what you might be able to do to build your resilience. And it's called filling your bucket. So very scientific concept. Basically, we all have a bucket, and the bucket is filled with who we are, things that make us happy, things that help us with our purpose, our families, our interests. All of those things are in our bucket. And we also are faced with bucket dippers. And dippers sometimes are ourselves, right? We don't do enough to build our resilience or take care of ourselves. But often the dippers are the stressors we're faced with. So the COVID-19, working in a different way, having to adjust to different colleagues or responsibilities. Both those things are natural. What we really want to do to cultivate resilience is to keep the bucket reasonably full. So that means we're always going to have dippers, but as long as we continue to nurture ourselves and try to build resilience, we'll keep our bucket going. Now, people do have holes in their bucket. It could be trauma, it could be depression, anxiety, or other crisis that they're dealing with. And so we may have to repair those holes by working with a counselor or a physician. But in the meantime, we can't stop filling it. So I also want to talk with you about some things that we can do to keep filling that bucket, as well as things that keep bucket dippers, that keep the bucket from being full, given dippers. So coping with change, as we've been talking about, is a huge factor. And I guess the piece that I want to mention that's different than the 10 things from the APA is that coping is a process. It's not a one and done. Coping has to do with our cognitions, or how we think about it, our emotions and how you feel about it, and behaviorally how you act. And so often, all of these things are happening rapid fire, and we think that we've coped with something, but we really haven't broken it down. Some factors that can affect our coping include our perception, right? How we see it. What's our attitude towards the source of stress? Are we familiar with this? And the last time it happened, it didn't go so well. And is the stress really risky or dangerous? Am I worried about my job? Am I worried about my family or my kids? And then again, our vulnerability for stress. like our physical health or other emotional difficulties. And so those are factors that can make it hard to cope, but when you break it down, it can actually improve your ability to cope. So some other things that we can talk about that will help with people filling their bucket is nurturing flexible thinking. Change is about adapting. And sometimes we adapt well, and sometimes we do things that numb us. We want to encourage stepping forward to take action and stepping back to rest and re energize. We want to keep the bucket full, we want to build reserves. And so, nurturing flexible thinking allows us to approach a situation, especially one that has a lot of ambiguity. Dealing with shades of gray is often very challenging for people, and we are dealing a lot with that right now when people are having new types of jobs and other ways of coping. And so, what we can do in those situations is think to oneself, what's one thing that I can accomplish today that helps me move in the direction I want to go? Some of what helps us do that is building predictability. So, of the things that we do feel that we have some level of control over, then thinking of incremental and actionable steps. Organize these ambiguous situations into smaller components. And also determine your scope of influence. It's really important to think through our circle of concern and our scope of influence. We may have a lot of things that are really concerning out there, our health, our well-being, the COVID, our financial security, and we think we can't do anything about it. What I encourage people to do is by breaking something down into more predictable parts, they can move a portion of the circled concern items into their sphere of influence or scope of influence. Also, thinking about how well you set boundaries, personally and professionally, and what your thinking styles might be, especially under stress. And then cultivate thriving through self-care and self-compassion. Notice when things are going well. I encourage people to do a gratitude practice where every day for a couple of weeks before the end of the day to think of 3 things that went well, 3 things for which they're grateful. Also, labeling your emotions can be very helpful when dealing and coping with stress. Those folks who actually can label their emotions are more likely to get through challenging times because there's also associated with that better communication. Revisiting their meaning and purpose and how it might change, getting in place personal development and professional development, and build a social support system, even if it's remotely. It's really important that we never walk alone. So, some things that I would want you to also think about in addition to sleep, exercise, relaxation, and good nutrition is get professional help when needed. We're still here. We're still seeing people at EAP and live well. Find ways to recognize and reward and support each other. Make compassionate decisions when frustrated. And then I want to leave you with these 4 key decisions about resilience. Will I nurture and invest in relationships, whether familial, collegial, or social, rather than isolate? Will I become intentional about self-care routines that reinforce a sense of meaning, joy, peace, and solace, rather than beat myself up if it doesn't go well? Will I embrace flexibility, accept my feelings, and seek to adapt and find opportunity in crisis rather than freezing in fragility? And will I focus on the aspects of my situation that are under my control, as well as accept and face the challenge the world has placed before me, rather than worry and avoid problem-solving action? So I'm going to end there. I know that we have some resources that will come up after the question and answer period. I also want to say little steps, but done so ritualistically, can lead to success and building resilience. Thank you.
Thank you, Maggie. We appreciate you sharing practical steps we can take to respond to the coronavirus. There are some questions. So we have time for just a couple. I wondered if you could talk about anxiety. You said it can be contagious. Can you talk about how that happens and what people can do when they start to realize that other people's anxiety is rubbing off on them?
Right. That's a really good question. You know, part of the answer to that would be getting to know yourself and then also your team. And we know that certain teams can adopt a culture. And the person who's the resilient leader, the person who's really trying to step out, will try to really point this out and introduce ways of adapting. There was a family therapist many years ago that talked a little bit about the herd mentality, how people tend to feel familiar with people who are expressing similar emotions. And I can see that. I mean, that's why we have groups of people that meet together. But I also think that it's important to think through what's normal for you and being clear and understand when it's creeping into group process.
Thank you. So a herd keeps people safe, but when it starts to stampede, it doesn't.
I like that. Yeah, it's a good analogy.
Okay. And also, can you talk a little bit about change fatigue? I think we, as you said, are going through so many changes and adjustments. And what is change fatigue? What can we do about that?
Sure. Well, and it's interesting because now I've also just heard about Zoom fatigue. There are people talking about how it's almost more difficult doing some of our remote communicating. But change fatigue has been here since before, I think, even COVID, although now there's been exponential growth. But essentially what that is when we're really asked to do so much so quickly that we become just this process of constantly moving and changing without tending to sort of our inner well-being. So our bucket's empty, essentially, if we go back to that buckets and dipper concept. And part of it is, especially for people who've experienced lots of change over the years at the university or at the hospital, they're relating and coping based on previous perception of experiences that have happened in the past. And that contributes to change fatigue as well. And the one thing I guess I would say is first recognizing it. Second, keeping your bucket with lots of reserves. Using words which create worlds. Keeping those steps of resilience present and ritualistically. And Richard Leider, who is a purpose author who writes about purpose, has talked about some days when we feel we haven't been successful in adapting to the change, that for that day, we're just going to grow and give. And we're going to focus on calming our body, calming our mind, or we're just going to care and not cure. We can't necessarily do them both all the time. So just a few thoughts.
Very helpful. I think that's very applicable to healthcare workers and so many of us who work in this community and live in this community. Thank you.
Yeah.
All right. So a recording of today's live stream and links to the resources that are available from this topic will be included on the loop later today. Next time, for our next wellness forum, we'll be joined by Dr. Patricia S.B. Pfeiffer, who will be discussing emotion regulation, especially aimed at parents and teens, but again, applicable to everyone. Until then, please take care, and we look forward to seeing you soon. Thank you.
Thank you so much.